Let's talk about the leg. Remember, this is not the leg, this is the femoral region. This is the leg, right? Let's just look at the beauty of it. This is the posterior leg really quickly. Something that we don't think about a lot. These are my hamstrings, right? This is the lateral side. So who can tell me what hamstrings are here on the lateral side of the leg? Actually,
Bicep femoris?
Bicep femoris, yes. And on the medial side, it's the semimembranosus and semitendinosus. How many heads does the bicep femoris have?
Two.
So you've got two heads actually crossing over the knee on this side and two heads crossing over the knee on this side, inserting into the tibia, pulling the knee hopefully straight. And we discussed that you could actually get some sticking here between the two so they don't pull very straight. And here's your knee pit. It's your popliteal region. But it's actually an endangerment site, right? Because the nerves and veins right there are too close to the surface. Doesn't mean you can't touch it, but you want to drive an elbow in there. But you can hit this stuff really hard on the outside. The other thing I want you to realize is, so you've got four heads crossing over here, but the gastrocnemius, it's hard to see from this, does the opposite. It comes up here, splits in two, and crosses over into the femur. So on both sides, you've got a hamstring coming down and the gastrocnemius coming up. And that's why you get this kind of swooping in and this crossing over. So even though your gastrocnemius's main job is to do plantar flexion, which is kind of what this leg is doing right here, kind of plantar flexing, which is why this is flexed, it can also help with a what of the knee since it crosses over the knee.
It can also help with what? I'm sorry.
What action can the gastrocnemius aid in with the knee?
Would it be a flexion of the knee?
It would be, yeah. The flexion of the knee. So its main job is to do plantar flexions to help you do your calf raises, right? But it actually is a backup knee muscle. Your body has all these redundant kind of systems. And so if somebody came to you with knee problems, you would definitely look at hamstrings, right? Because they cross over the knee. By the way, sorry, let me back up for a second. Sometimes when people come in with joint problems, the first thing I do is don't figure out the joint problem. I work every single muscle that crosses over the joint to loosen up pressure on the joint. Because a lot of times their joints are just tight, right? Everything's tight in there. So let's think of all the muscles that you'd work just if somebody had a knee problem. You'd work hamstrings. They flex the knee. What muscles in front of this femoral region extend the knee? Big group of muscle.
Quads?
The quads, right?
Quadriceps?
Yeah! Good job, sir. You're in the right class, apparently. Quadriceps femoris are in front. So we get all those because they insert into the tibia via the patellar ligament and the patellar tendon. They all come down and insert in here and then go into here. So we would loosen these up for sure. Would we want to get the IT band? I'm sorry, what?
The gracilis, doesn't that cross?
The gracilis does cross, Miss Petrie. It's the only adductor that does, and so we would care about this pes anserinus area because the sartorius comes across the knee, the gracilis comes across the knee.
You'll care about the Miss Monreal.
That's right. You've got to take care of that. The Miss Monreal, which is found on the medial side, and Monreal starts with an M, and medial starts with an M, all found here. So we would care about that. We'd care about the IT band for sure.
Mm-hmm.
Which, by the way, since we care about the IT band, that means...
You'd care about the gluteus maximus then, wouldn't it?
Yes. I'm pausing for a second for you to recognize how your brain is working right now. And how you're putting together information.
Thank you.
So,
carry on.
So you've got the tensor fasciolata here in the front and the gluteus maximus, and so those two, believe it or not, can affect knee tension quite dramatically. So we would do all that if somebody came with knee problems, but you guys, because you have such an amazing massage class and you've been doing your homework would also remember to work the gastrocnemius, which a lot of people don't think of as being a knee muscle, but it is. Cool. All right, so that was a lot of upper leg stuff, the thigh, femoral compartment, but I just want to kind of make that point. Now, sorry, yes, Miss Monreal.
Okay, so I have another friend. I have a lot of friends, so don't worry about it.
I doubt that.
So she, okay, whatever. I pay them. She has a torn meniscus, which she does not want to get worked on. Not massage. She doesn't want surgery.
Yeah, everybody,
okay?
by the way, the meniscus is a pad inside the knee. You can't work on it even if you wanted to. Just so everybody
Well,
knows.
so her knee swells up a lot with fluid. Is that something I should not work on? I mean, I'm not going to dig in the knee, but I'm just saying, like, is that something you should just stay away from, especially when somebody has fluid buildup? Occasionally she has to go get it drained, but, like, are you going to hurt anything?
Probably not. Her problem is probably entirely internal. And like you said, I wouldn't go digging in there. But to be honest with you, I'd even try flushing it out. And by flushing out, I mean you pretend like the thigh is a tube of toothpaste and you kind of stroke up and start to flush the fluid out.
Okay.
Yeah, and I'd see how she responds to that. I wouldn't go nuts with it. But I've done it many times before and people get relief from it. It's temporary, right? Because the problem's not going to go away. But she's coming to you as a way to manage her knee problems. So I would definitely try that out. And no, it's not a big danger. The torn meniscus is internal. You're probably not going to make it any worse. Any relief that you can do externally to it is fine. And by the way, the general rule... general rule is you don't work on stuff that's swollen. But this swelling's coming from deep inside the knee and it's been going on forever, I'm sure. It's not a big deal.
So if you don't know the answer to this next one, that's fine. But, like, why does it fill up with fluid? This only really happens to her like maybe 2 or 3 times a year. It doesn't happen all the time. But what causes that?
Yeah, and it's okay if I don't know the answer to that one?
Yeah.
Okay, then never mind. No, I'm kidding.
Okay.
Actually, I probably do know the answer to that. She has a torn meniscus in there, and a few times a year she does something that irritates it. It's very easy to irritate the torn meniscus. And swelling is your body's reaction to, it's your body's attempt to try to heal a place. And let me tell you what swelling does for you. Because we always are like, reduce swelling, and there's even a school of thought out there now that says we probably shouldn't do that. Because it used to be like, rest, ice, compression, and elevation. And the compression was to reduce swelling. Now some people are saying, we probably don't want to fight the swelling because the swelling has a lot of good effects. So,
Kind of like a fever?
yeah, kind of like a fever. You're running a fever for a good reason, right? You're running a fever to raise the temperature in your body and make it less hospitable to foreign invaders, right? Just like if you come over to my house and you won't leave, I turn up the temperature in the house and you're like, oh my gosh, it's 95 in here. Yeah, you should go home. Yeah, okay.
I would love it.
Yeah, you're right. So maybe in your case, I'd turn the temperature down. But, so anyway, one thing swelling does is it immobilizes a joint. So if I hit my finger, it swells up and now my finger won't bend very easily. We've all gotten something where we swelled. It's meant to do that. Because my body is saying, quit moving your darn finger. I want it to get better, right? So it's splinting it. So the knee, she injures the knee and the body rushes all this fluid in there to try to keep her from moving the knee. So that's one thing. But there's something actually much more profound that goes on with swelling. Swelling brings tremendous amounts of fluid that's packed with white blood cells and lymph and things like that to the area to heal it. So it makes a very soupy mixture in that area so nutrients can get into that area and try to heal it. It's your body's attempt to try to flush the area with more fluid so that blood-like substances can get in there, because blood is life, and make the area better. So it's that swelling fluid is usually full of lots of white blood cells and things like that. It's meant to bring healing to the area. Yeah. In fact, there is our, cupping. So let me just give you an example. This is not swelling, but this is along these lines. One of the reasons we do cupping, which is like suction cups, is to lift the fascia off lower layers. But you'll see sometimes people get bruises from it. And sometimes that's intentional, because what happens when you bruise an area is you haven't done that much damage, right? But the body's like, there's a problem here. So what does the body do? It rushes to that area, right? Like if I wanted help right now in class, I might yell fire. There's not a fire, but I bet I'll get somebody in here really quick. So bruising an area or a swelling that the body's creating is actually meant to draw resources to that area. And so I think your friend probably irritates the meniscus. It's probably not hard to do. It's already torn and it shifts around in there and something gets irritated and then the area swells up. And it's the body trying to splint the area and heal it, bring more nutritious fluid to the area. And by the way, that fluid also gets other stuff out, right? So if there's stuff floating around there, it helps kind of get that out as well. That's the whole concept of swelling. Yeah.
That's so funny that you brought up cupping, because we were asking Mr. Ibarra about it yesterday, and he said he was going to ask you something about it because you didn't want to do it anymore because of liability issues. But I think we would love for you to at least show us a demonstration or something.
Sure. Yeah. We can work some out. Yeah, anyway, absolutely. The answer to that is yes, the cupping thing. No problem. Mr. Gandaris, you have your hand raised.
Oh yeah, I was gonna say, I think my favorite saying for cupping is 5 minutes worth of cupping is worth 20 minutes of massage.
Yeah, yeah. There are some things I really like about cupping. We don't have a fancy cupping set here, by the way. You can buy the set that we have here for about $15 on Amazon. It's kind of worth it just to play around with. But I've seen cupping machines where it puts a vacuum on there and they slide the cup around in the body. And that's kind of neat because it's kind of like skin rolling, kind of lifting up the skin all over the place. And it's very impressive for increasing blood flow. Very impressive. And one of the nice things about adding it into your repertoire, because you are legally allowed to do it, is it saves your hands and your body, right? You add a little 20 minutes of cupping into it. Maybe it's an add-on. Maybe you do massage, and then you add on 30 minutes of cupping at the end for an added charge, but it's actually not a lot of extra work for you. So, yeah.
I have a cupping machine. I could bring it in for people just to try it.
Yeah. Let me just run it by our legal thing, but we can do something like that. We absolutely can. I really mean it. The thing that everybody has to be aware of, if you choose to get cupped, I'm actually not worried about it hurting you. You can have bruises, and you can have bruises that last for a month. I've seen it. That's what I want you prepared for. So don't stick the cup on your forehead and just be prepared for that. It's like a giant hickey, and it can be, if it's on tender skin, it can be there for a long time. So that's why we kind of warn people about it and get a little bit, concerned about it. We just don't want some student to come back and say, they disfigured me. And it's like, well, Ms. Torres, do you have your hand raised?
Yes. So about Martha's friend with the knee
Her friend?
problem.
Yeah.
Yeah, her friend. Okay. So is a lymphatic massage good for it? Like to drain the fluid?
Yeah.
That's like the better approach.
Yeah. I mean, I don't know if it's the better approach, but I would recommend lymphatic massage. Yeah. I can't comment much more about that because I'm not very good at lymphatic massage. I haven't gotten very much training in it. You can go get like 4-hour training courses and stuff like that, and I've done stuff like that, but that's a bunch of baloney, to be honest with you. Lymphatic massage is really advanced stuff, actually, and you really should go take at least a 3-day course. There is a place in Australia that I think it's like a 2-year school. I mean, it's really, it's big stuff. They do I've seen some really neat results with it, and so yes, with somebody who knew what they were doing, I would say, yeah, try it. Yeah.
Okay, another thing. So if your fever it's not bad, then why do people want to get rid of it? Like, and when you have a fever, like if it's a defense mechanism and it's good for you and it's good for your body and it's fighting what it's supposed to be do. I understand in children because they could get seizures. So you have to be careful with them. But what about adults?
Adults too, by the way. High fevers can lead to seizures. When people get up to
high fever, yes.
Yeah, when people, adults or children get up to 104, it's time to go to the hospital. We're worried about some really serious stuff. But my answer to that is because we live in a symptom-focused society, and not a source-focused society. So what I mean by that is almost all of our medications, almost all of our approach to life is symptom-based. Like cold medication. Cold medication doesn't do anything for a cold. It attacks my symptoms, right?
Yeah.
And by the way, I am guilty of this too, right? So I often am managing symptoms, you know, like last night I went home, tough day of work, right? It was a great day, but it was tough. And I went home and I'm tired and I'm a little bit frustrated. What do? I have a drink. That is a symptom-based approach. Does that really help my stress? No. No. So, and that is a very American approach. It may not be a drink. It might be a donut. It might be something, right? But the fact is we have a very symptom-based approach. I mean, look at things like plastic surgery and all this, and there's nothing wrong with these things. I'm not suggesting that, but they're symptom-based. If you look better, you'll feel better. If you take this drink, you'll feel better. If you lower your fever, you'll feel better. They don't really think about like what's best for the body and the intelligence of the body. We don't really work with the body. Even our modern medical stuff is like, oh, you've got a problem? Let's cut it out. Let's remove it. In other countries, sometimes they think that's pretty barbaric. They're like, that's a really weird way to approach the body. But anyway, so I'm not saying that's right or wrong. I'm just saying we have a very symptom-based, approach. And so I think the idea is, hey, the fever's bothering you, and it is. It's very uncomfortable. Let's get rid of the fever. But you're probably fighting against what's really working for you in general. That's just an opinion. That's my opinion. Anything else, Ms. Torres?
No, no, because that's exactly the way I think. Like if I read about it, like, it says this, that's for your body. You just have to make sure that it doesn't go above, like whatever, especially for the kids, like I said. So like when I have fever, I just let it be, so I just want to know why do people think it's a bad thing when it's not so high, when it's just a low fever?
Yeah, you should let it run. I agree. You should let it run its course. I think it's good. Yeah. But look we don't like to be stressed, right? We don't like to have our bodies stressed, even though it's probably good for them on occasion, right? You guys didn't like taking the test, but it made you learn. Like, it's just not pleasant. Not pleasant at all. Yeah. Miss Petrie. You had your head raised.
Yes, please. I was gonna say, you were saying that compression, that you shouldn't be doing compression. When Miss Monreal was talking to our friend.
I was saying
Okay.
that because of the same thing Miss Torres was talking about kind of allowing the body to do what it does. I don't try to get rid of. I don't try to compress away swelling. That's me. Different doctors have different opinions
Well,
about
makes
this.
me curious about things like compression socks, where people have.
That's a little different. So, yes, they're trying to reduce swelling, but they're not trying to really reduce swelling. Compression socks are for people that are having a hard time with venous return, their blood flow back up, and it's pooling in their lower legs, and it causes varicose veins and all sorts of problems. And so the compression socks are trying to kind of squeeze the blood back upstairs and not let it pool downstairs. Okay. Yeah.
Okay. Right.
Yeah.
You're talking more injury related then, Mr. Tepsa?
Yeah. I'm talking more injury related. Yeah.
Got it. Okay.
And by the way, I am not so confident. If a doctor said, hey, I want to keep this bandaged or whatever, and I think we should keep it under compression, whatever it was, I'd be like, yeah, you're probably right. I don't know. I'm just saying there is a big school of thought out there that's kind of what I'm going to now call the Miss Torres school of thought, which is if it's not majorly bad, let your body do what it's supposed to do. The swelling is there for a good reason. And everybody agrees with that. They agree the swelling is there for a good reason. But it used to be that they thought, well, if we keep the swelling down, reduce the swelling, they're going to heal faster. Now there's some people saying, well, no, if we allow the swelling, they're going to heal faster. Yeah. But compression socks are more about poor venous return. Those people need to wear compression socks and walk more, by the way. Because this muscle on top is called the gastrocnemius. What's the muscle underneath called?
Is that the soleus?
Yeah. And what's the nickname for the soleus? Anybody? There it is.
The Solster?
The Solster? The Soulmeister? It's the second heart. The soleus is called the second heart. It does not cross the knee, by the way. All it does is cause plantar flexions all day long. But it's a big, thick, powerful muscle that you can access by pushing through the gastrocnemius. But one of the best ways to access it is actually by pushing from the sides, because it's accessible right here on both sides. It's actually what gives width to your calf. This makes your calf look all sexy and cute. This thing makes it look big and wide. And accessing it from the sides, actually trying to kind of make your fingers meet in the side underneath the gastrocnemius is one of the best ways to access it. It's called the second heart, and I remember that by heart and soleus. Heart and soleus. That's just how I remember. It's called the second heart because they believe that it creates a pumping action in your legs. All muscles create a pumping action because they kind of suck blood in when you use them and pump it back out again because they need the blood, then they want to get rid of it. So, but this muscle is actually really thick and really powerful, and it's in your leg where blood pools. And so one of the best things you can do for to prevent varicose veins and things like that is to get up out of your chair and walk around a little bit and exercise your foot, because you're making your soleus pump, and it's getting blood, venous return back up. They think it helps get blood back up to your heart. That's why it's called your second heart. Heart and soleus. Yeah. And I wish, I don't think they do, I was hoping we could see, we can't really. Sorry, I was hoping we could see the plantaris, but we can't really. So, that's just kind of a little overview of where we're headed. Where we're headed. By the way, underneath, we haven't talked about these at all, but underneath the soleus and the gastrocnemius and the soleus, there are more muscles. There are more muscles. There's a diagonal muscle that's literally meant just to unlock your knee when it's straight, to kind of unlock it in here. There are muscles that are in back here, just like my forearm muscles, that reach underneath your malleoluses, your lateral and medial malleoluses, the bumps on your tibia and fibia, that puppet your feet, that hook under and hook to your toes. Just like most of the muscles for my hand are actually down here. You know, that's why you see my arm move when my fingers move. Same thing's true here. So a lot of these muscles hook to tendons that go down under your feet and work your feet. In fact, we've learned about a tibialis anterior. That means there's a tibialis posterior. Otherwise, they wouldn't call it anterior. Yeah? Cool. So just to let you know, there's stuff back there. And then, again, this is just a preview of coming attractions. Then we've got all sorts of important muscles up here. We've got the tibialis anterior that actually comes down, crosses over your foot, hooks underneath it. We've got some ones on the side called the peroneals that reach down underneath your foot and meet the tibialis anterior underneath and create a stirrup. And we're going to learn about all these. And not only do they help you dorsiflex the peroneals or the fibularis and the tibialis anterior. I was just talking to one of you about these. They also help to rock your foot back and forth to help you balance. So we're going to learn about all sorts of really important articulate muscles down in here that do that. And again, a lot of them go around your malleoluses, which is why it's kind of nice to actually to rub, not hard, but to rub around people's malleoluses on the backside. They've actually got a lot of tendons going through there. Very cool. Okay. All right, so let's take a look at bones, all that kind of stuff. I want to talk to you guys about shin splints a little bit, just to keep this a little bit more entertaining for you. Good times. Okay. All right. So let me present here to you. Oh, hold on one second. Bear with me. Okay. Now let me present to you. Okay. So can we see chapter 7? Leg and feet. Cool. Let's just to thank you, Miss Cooper. Just to liven this up a little bit before we start talking about bones, which can be a little dry. Let's talk about shin splints. So I've mentioned them very briefly, but I couldn't get into a lot of detail because we need a little bit more understanding of anatomy, and we're definitely there now. So there are 2 types of shin splints, and this isn't exactly true. There's really only one type. There's 2 things that people call shin splints. This is the outside of the leg. This is the lateral side of the leg. A lot of people get sore in their anterior tibialis and their peroneals, which run right through here. They run in the anterior compartment and the lateral compartment of the leg. Kind of your shin. I mean, this is your shin bone, but kind of over here on the lateral side. A lot of people get sore here because you use those muscles to balance your foot and to lift your toes up. And they get sore from running, driving, whatever, and they'll say, I have shin splints. And I don't argue with them. I'm just like, oh, they're tight in this muscle. That's not really shin splints though at all. But that's what they've been calling that. And so you're getting a lot of people with that. This is a very important area to work on everybody. In my normal, regular massage, I make sure to hit this on everybody. I mean, unless you come up with a particular problem where I'm not going to spend. But if I give you a full body massage, even just a 60-minute one, I'll hit your muscles down here. I think they're that important. So I don't just hit your calf. I get your tibialis anterior and your peroneals. So lots of people call that shin splints. They get sore, achy in here, and they love being rubbed here, and you'd be surprised some people can take full elbow strength in this area. So, but that's not really shin splints. True shin splints, a long time ago, were actual microfractures in your tibia from intense running and things like that. But they don't use the term that way anymore. Now they kind of mean an irritation of what's called the periosteum. Does anybody remember what periosteum is? It's a tough one. We haven't talked about it in a long time. Yes, Miss Cooper.
I'm thinking, I guess, is that the covering?
Covering of what, madam? It is a covering. What is it covering? You just cut out. What's it covering, Miss Cooper? You there? Miss Cooper. I think Miss Cooper said it. Miss Cooper, we can't hear you though. Type it in the chat box.
My connection is horrible.
Chat box it. Because I think you're onto
something. Can you hear
something.
me now?
I can kind of hear you now. Type in chat box.
I'm trying. I have bad connect.
Covering what? I just want to give her a chance because... Yes! 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 Periosteum is the fascia that covers your bones. Remember, we talked about fascia that covers muscle, endomysium, paramysium, epimysium, but the fascia that covers that covers bones is periosteum. Osteo is bones. This is the fascia that covers bones. It's super important. Why? Because tendons and ligaments attach to it, right? It's sewn into the bone. It actually is, really, your periosteum is actually kind of like this fascial network that gets filled in with calcium and potassium and makes the concrete that's your bones and holds them together because it kind of acts like this mesh rebar for your bones. But then tendons and ligaments literally grow into the periosteum and make these really solid connections. Otherwise, you'd have these kind of ropes attached to your, or drilled into your bone, and they tear off all the time, but this stuff grows right in. So the periosteum is the fascia. It's the living fascia. It feeds your bones. It is your bones that covers your bones. Thank you, Miss Cooper. Brilliant. So,
You're welcome. Sorry about the connection.
no, it was worth it. So, On your tibia, just like every other bone in your body, you've got periosteum. Yeah? Let's advance this slide. But you can get periosteitis. What does itis mean?
Inflammation.
Inflammation. Tendinitis is inflammation of a tendon. Ligamentitis is inflammation of a ligament. If a student takes a really long test, they get studentitis. It's an inflamed student. Periosteitis is inflammation of the periosteum. That's all it is. Well, shin splints these days are when you have this pain on the medial side of your shin. You guys have probably experienced this. The medial side of your shin. And what happens is that muscles that attach into the periosteum on the medial side of your shin have been pulling, tractioning the periosteum so much that they've caused it to get inflamed. So this is usually an overuse injury. It's not a one-time thing. This is like you go to boot camp and they start running you 4, 5, 6, 7, 8 miles a day, and your shins start hurting. They go, "Oh, you got shin splints." Yeah, you do. You've got this periosteitis. You've got inflammation of your periosteum, and what happens is your soleus. Remember, it's back here behind you, but it attaches to your tibia all along this edge, and it's attached to the periosteum. And then you've got your flexor digitorum longus, which is back here too, that reaches down underneath your foot and causes you to flex your toes down. And yes, you use it to curl your toes like this, but you also use it every time you run or walk. And then you've got deep, deep curl fascia in here, which is just deep fascia inside your leg, and it's attached to the bone too to kind of hold everything together, and all that's getting pounded and pulling on here. And rub the inside of your shin right now, the medial side of your shin. Find the bone there, rub it in there. It's probably a little sore. That's the periosteum there and all the stuff pulling on it. And you could actually massage the soleus right next to the bone here. I think that's on both sides personally, but it's usually pronounced on the medial side, to help make that better. It is an overuse injury where the muscles are working really hard. The soleus is working really hard to make you do plantar flexions, but it's pulling on the periosteum every time because that's how it's sewn onto the bone. And that's why people think that they feel it in their bones. They come to you and they say, "My shins hurt." It's my shins that hurt. Well, it kind of is. It's your periosteum. It's the fascia around your tibia, around your shin, and it does make you feel like your bones hurt. It feels different than muscular hurt. Does that make sense? But it is very effective to rub it because you get blood back in there and things like that. And you want to loosen up all that stuff. So I just thought it'd be kind of fun to talk real briefly here about shin splints because you're going to have people come to you with them. And it could just be tight anterior tibialis, things like that, but quite often it's this pain in their bone on the medial side here because of the soleus mainly attaching to that bone and pulling on it. You get it in runners a lot, hikers, people of that nature, people that are doing those type of activities, if that makes sense. Cool? Kind of interesting. Yeah. And you can feel it on your own body. It'll quite often feel tender in that area just because it's a high pressure area. I mean, think what your lower body is doing. Like, for me, we don't realize this, but this is essentially how my foot works. This is my heel, this is my foot, this is my tibia. My calves and back pull this up so I can do a plantar flexion, right? They pull this up so I can stand up on my toes. What we don't realize about is lever-wise, this is a horrible lever. This lever is built for speed, not power. It's got just an inch back here to lift up and to push all this toe and foot down. What does that mean? That means in order for me to do this right now, to stand up on my toes right now, to lift 230 pounds, this is not an exaggeration. In back, my muscle has to pull 500 to 1,000 pounds. Your calves are actually capable of pulling about 1,000 pounds of force, if not more. back here. They have to, because this is a lever that's built for speed and not power. That's a whole other discussion. But the levers in your body are built for speed, not power. And so normally you want to lever way back here. So you pull it, it's real easy, and you get a little bit of movement up here, but we actually get a lot of movement. And so your calves are under an incredible amount of force, which is why your heel bone, by the way, is called your calcaneus. We're going to learn that today. But your calcaneus is this heel bone here. This tendon that is a tendon that's made up of three muscles coming together, the soleus, the gastrocnemius, and the plantaris, all come together in this tendon. This tendon is called the calcaneal tendon because it goes into the calcaneus. That's the official name for it. Some people call it your Achilles tendon. Right? Remember Achilles? Anybody know the story of Achilles? Achilles.
I think so.
Yeah?
Yeah, isn't that was like the one spot on his heel that would kill him?
Yeah. Achilles was dipped. He's a demigod. Not a god, but a demigod. He was dipped by his mother, I believe, in the river Styx. And she held him by his heel, right here on his Achilles tendon, and dipped him upside down into the river Styx. It's the one place he didn't get his immunity. And it's the one place he could be killed. And he eventually got an arrow right back here. And that's how he died.
Immortal.
Yeah, he was immortal except for this one area. But this tendon is quite often, even by doctors sometimes, called the Achilles tendon, but it's the calcaneal tendon. Anyway, they all fit back there. It is super thick. I can't even describe it. It's a rope. It's super thick on people. And we all know how strong tendons are. You've seen them like in chicken breasts and things like that. We have a tiny little bit. This thing, I mean, you could tow a truck with it. I'm not exaggerating. Thickest tendon in your body. What is the most commonly ruptured tendon in your body? Most commonly torn, ruptured tendon in your body.
ACL?
Good guess. Achilles tendon. ACL.
Really?
ACL is a ligament, by the way. Most commonly torn tendon in your body is the Achilles tendon, which happens to be the thickest tendon in your body, which tells you how much force it's under. It tells you that your calves have to be pulling that hard, that lever works that hard, that they're not lifting 230 pounds. The lever makes it seem to them like they're lifting 1,000 pounds, and that's the most common place to get a tear of a tendon, even though it's the strongest one in the body. And it's bad news bears when it happens. They have to reattach it back on the heel, and it takes a very long time to heal. Anyway, Achilles tendon. Or calcaneal tendon. Let's look at bones. Questions before we move on to bones? Do we need a break before we move on to bones? Do we need just to kind of, I mean, you guys came off a hard night,
Sure.
all that stuff. Yeah? Let's just take a 10-minute break. Let's just, I feel like we've actually covered some really important stuff. And let's just take a 10-minute break. The folds of the body are, so. Okay. Let's go a little bit further. I recommend, by the way, that you all become expert foot massagers. I know Mr. Ibarra enjoys saying that I'm obsessed with feet. I think he's probably right, actually, now that I think about it. I am obsessed with feet. I think they're amazing. I think they have the hardest job in the body. I think it's amazing they don't crumble all the time. And I think that clients who love foot rubs love 2 hours of foot rubs. And you can sit down at the foot of the table and do them. And so I think it's something you should practice and get really good at. And I think the way you practice, by the way, can be in lab, but also can be with somebody that you're living with, and you watch a movie with them and just have them put their feet on your lap and try to rub their feet through the whole movie. What happens is you're going to get terribly bored. And when you get bored, you start exploring new ways to explore the foot. And what you really want to do is find out if you can separate the bones of the foot. Obviously, you can't really separate them, but can you get into areas, or are you just rubbing over the surface of a foot? So if you feel like you have not a lot to do on a foot, that's a very normal feeling. but that's because you're not getting into the foot. And so I'm hoping through this exploration of feet and the bones that make up the feet and the muscles that make up the feet and the way feet work, that you'll be really encouraged to become master massage therapists when it comes to feet. And if you think about it, really what makes a great massage therapist from the client's point of view is that you have a lot that you can do in each area, right? That you could spend an hour on a back and it would be an effective hour. That you could spend an hour on a foot, hour on head and neck and shoulders, hour on the legs, things like that. That's really helpful because you'll have lots of clients who will want an extra half hour or hour of footwork, which is fantastic for you. But you also have clients that come in all the time and they say, I'm a runner, just do my legs. Well, you better have an hour of work to do on their legs, right? Things like that. So just things to think about. I really big believer in the movie idea. Watch a movie, rub somebody's foot, and then do it 20 more times. And you'll be really good at feet. All right.
I bet you still do that.
You still do that?
I bet you still do that.
I still do that, yeah. It makes my girlfriend really happy. I'm sitting down, and it's something I can do to be kind for her putting up with me. And it makes you very good at kind of working intricately into the feet. There's also something almost biblical about it. I mean, like Christ, washing people's feet and like this kind. It's a very subservient thing in a very beautiful way, I think. It's a very neat way. Oftentimes, depending on how the room is arranged, when I would walk into a massage room, the first thing I would do is grab the client's foot. I'm at the base of the table and I'm kind of engaging them in the safest place possible. I really, really like that stuff. Ms. Petrie, you have your hand raised?
Yes, but I actually just want to make a comment. You are not difficult to put up with, for one. And for two, one of the greatest things about you is that you have always been considerate of what other people might need.
Well, thank you. This has been quite a
Like,
time.
I've seen you in relationships. Like, I know what you're like in a relationship.
Thank you.
So,
This is
you've always put your partner's needs, you made those very important.
Thank you. This is quite a turnaround from this morning, Ms. Petrie.
Come on.
I'm enjoying this moment. Yeah. Thank you.
You know that I love you.
I do. I don't blame you, actually.
I just don't love every moment with you.
No, I don't blame you. I don't blame you. I looked at the test. It took me a long time just to skim over the tests. Yeah, it was big. Hey, let's look at this leg and kind of look at how the leg works. So feet are not that different from hands, everybody, and we're going to get to hands later, and that's why I mentioned that. For example, like how many forearm bones do I have? 2, right? An ulna and a radius, right? Well, how many leg bones do I have? 2. And my toes are a lot like fingers. They really, really are. We're going to see that the bones and the muscles, actually, we're going to see are very similar. And you've even kind of got wrist bones, but in your ankle bones and such. Not quite the same number, but there's just a lot that's similar. So essentially the weight of your body is because your femur sits on the bigger of the 2 and the medial of the 2 leg bones, the tibia, right? Sits right down on there. The fibula is lateral and it's a much smaller bone. Right? And the femur does not sit directly on that at all. So it's a much smaller bone. So essentially, I'm not saying the fibula isn't important or whatever, but essentially your femur is stacked on top. Your knee joint is your tibiofemoral joint. It's your tibia meeting your femur. This is your knee. And if you look at this picture here, you'll see they're very big, actually. Your tibia branches out like this. Your femur comes down like this, so you have this big surface for your knee. Then there's a bone in front called your patella. Your patella is 2, since there's 2 of them, 2 of the 10 sesamoid bones in your entire body. Anybody remember what a sesamoid bone is? Yes, Miss Monreal.
I thought I remembered, but I think I'm mistaken, so never mind.
Okay. Anybody else? Miss Petrie, is your hand up? Okay.
Is it like an opening? Or
No,
is, no, that's a.
that's a what? A
Sphinx.
A sphincter. A sphincter.
Sphincter.
A sphincter.
Stinker. A stinker.
A sphincter can be a stinker. A sesamoid bone is a bone wrapped completely in tendon. And it doesn't really, directly connect with any other bone. Directly connect. It connects to the tendon, but it's just kind of sitting there floating in tendon. And it's in high stress areas where your body is worried about the bone sliding out over the other bone. It's very hard to imagine, but very important to imagine. I've shown you this before, but I'm going to show you again, because it's just, when I squat down, we take it for granted, right? But when I squat down, my femur, where does my femur want to go right now? It doesn't want to stay over my tibia. It wants to shoot straight down through the floor as I squat down. It wants to, as I do this, now all this force is coming down here, it wants to do that. And if that happens, it's a very bad day. You will die, a horrible death. So what happens is the patella is in front, keeping it from going out over. And the quads grab onto that patella and grab on down to the tibia, and that's how you're able to do leg extensions. And that's a high stress area. And you find sesamoid bones in high stress areas. You only have 10 in your body, and the patellas are the largest ones. By far. Anyway, so we've got the femur coming down to the tibia to form, what's this joint called? Miss Stanley? Where the tibia meets the femur.
I believe it is the tibiofemoral joint.
Yeah, thank you. Tibiofemoral joint. And then it goes down the tibia, and then the tibia at the bottom sits on a bone called the talus. And it literally is kind of the rocking bone for your ankle. And the tibia sits down on that. You got the rocking bone called the talus, and they call this, I wish they called it the talotibial joint, but they call it the talocrural joint, because this is your crural. But I really wish, I would be happy if you guys in my class called it the tibial joint, because that's what it is. And then the talus sits down on kind of the carpals of your feet, and then goes out into the fingers, but these are your toes, of course. So let's look really quickly. This is an anterior view of the tibia, and the fibula. And can you guys see the medial and lateral malleolus at the bottom? Good. Those are the bumps that you see on your own ankles. You know the bumps you have on both sides of your ankles? Little bolts you got there? That's what those are. And what fits between those two bones and those bumps? The talus bone. That's kind of what holds your ankle onto your foot. Holds those bones onto your foot. Is the talus bone, before it turns into the rest of your foot, sits between those two things. Right? Do you guys see the bump on top of the tibia there? Not all the way on top, but where it says tibial tuberosity? Yeah. What's that there for? What inserts in the tibial tuberosity? You can feel that on your shin too, by the way. That's below your knee and you can feel it. Feel it right now. What inserts in the tibial tuberosity? Anybody?
Is it the pes anserinus?
No, that's off to the side there.
Okay.
You can actually see its location there. No, pes anserinus, you're right, receives 3 muscles. But what inserts in that big?
Oh, I see that. Okay, I see that.
Cool.
Okay.
Is
Well, that's
it
your
the
first question.
tibialis anterior?
No, I like where you went with that though. I do. But you're wrong.
Is it the rectus femoris?
Yes.
Okay. And all the other ones? All the other
Yes. Yeah, your quads, people, come on. Your quads insert into your patella, which inserts into your tibial tuberosity of your tibia. That's the big bump on your tibia that your quads all grab the patella, and the patella grabs it so that you can do a leg extension and kick a ball and squat and all sorts of cool stuff. Yeah, that's what it's there for. But it is a palpatable point. So if you find that bump and you go up, you go superior, half an inch, you are on the patellar ligament. You go up farther, you're on the patella. You go up farther, you're on the patellar tendon, and now you're into the quads. Yeah, it's tibial tuberosity. We do see that the pes anserinus area is just medial to that and a little bit lower. These medial and lateral condyles of the tibia are where your hamstrings attach. You guys probably forgot that, but your hamstrings come down off the femur, down off the hips, and reach across and grab onto those condyles of the tibia. That's how you that's how you flex your knee. Yeah. And by the way, just a little interesting point, you'll never touch it in your life, but on top, do you see the medial and lateral intercondylar tubercles? They're up on top. You'll never touch them in your life. They're inside the knee. But that's where ligaments that are inside your knee attach the tibia to the fibula to try to keep it together. Ligaments inside your knee are in there and attached to that. And the meniscus is in there and all sorts of stuff. We'll study knees a little bit more, but that's where that stuff is. So we're just kind of giving you a view of these bones. That makes sense. And this is the back side. This is the posterior side of the tibia. Does somebody see where it's the soleal line there? Soleal line? Yeah. Do you see how it's kind of a diagonal line like this? What do you suppose the soleal line is? Yeah, that's right. The soleal line is the origin this diagonal line here, that's the soleus. This is the soleus. It attaches right here. It attaches on the sides too. But this is called the soleal line. It's kind of a ridge in your tibia where it attaches. And so it's diagonal here and it's diagonal in the picture because that's what it's doing. It's attaching right there. That's the soleal line where your soleus attaches to, right? Your soleus, your second heart and soleus. Cool. Wow. Keep it together, buddy. All right. Let's move right along for a second. We are not going to get into all the anatomy of the patella, but it does have some facets so that it stays on in front of your knee. And some people do kind of get them out of alignment a little bit. They usually go to physical therapy for that. They usually strengthen their quads for that. Here's a picture of a bent knee. It's at the edge of a massage table. Great picture of where the tibialis, the tibial tuberosity is, the patella, the big adductor tubercle, right? Adductor tubercle, which is for the adductor magnus to attach to. Remember, the adductor magnus is an adductor, but some people even almost consider it a hamstring because it's so far back in the way it works and it's so big. Yeah. You can feel all of this stuff right here in this picture on your own knee. Right? You can feel your kneecap. And you can actually feel your adductor tubercle. It's on the medial side of your femur there, and you can feel your tibial tuberosity, and you can feel where the pes anserinus inserts. It's usually really sore. Cool. This is just the other side. I'm not too worried about that. We're not going to worry about that. That's it. Can you believe that's it?